All right, we are back with our experts, Catherine Sevier with AARP, Steve Edmonds with Alliance Insurance Services, Laura Packard from Healthcare Voices answering your health insurance questions. All right, so there is someone here asking, what is the income top limit to qualify for the Medicaid expansion in North Carolina? Laura?
Well, first of all, the Medicaid is available to low-income individuals and families and people with qualifying conditions, such as being blind or disabled or pregnant, or if you have supplemental security income or other type things. So in Medicaid expansion, this now means that adults ages 19 through 64 that earn up to 138% of the federal poverty line may be eligible. And so what those amounts are is single people earning about $20,000 a year, or families of 3 earning about $34,000 a year. But we don't have exact numbers yet. So what you should do is go to medicaid.nc.gov to find out more.
Okay. Medicaid.nc.gov. We probably cannot say it enough. All right, Catherine, this person's asking, we have Medicare and TriCare for life. We have been warned that we could mess up our TriCare if we add an Advantage plan. Can you advise?
So TriCare is a benefit for retirees that it acts like a supplemental plan that you might buy on the open market. If you go into a Medicare Advantage plan, it won't pay the same way it pays now, but it would still provide coverage as a first payer if you were traveling or something and were out of network. So it would cover those things, but you would lose the benefit of the supplemental part of it when you're in an Advantage plan. It would change.
It would change, and you have to decide whether that's good for you or not.
Yes, exactly.
Okay. Steve, this person says, I'm eligible for Medicare in April. I already took Social Security at 62. I know I'll already be enrolled in Medicare. I don't know why they know that.
Well, a lot of times when people are, if they start drawing Social Security early, 62, 63, 64, Social Security will automatically enroll you because you're already drawing. So they will automatically enroll you in Medicare and go ahead and mail your Medicare card out. I see this quite often.
Okay.
But I would never assume that that's going to happen either. So when you're getting close to that 65th birthday, if you're within about 3 months and you've not received notice from Social Security, I'd be proactive and call them and say, hey, I want my Medicare benefits turned on when I'm 65.
All right, and they've got a part 2 to that question. They say, do I have to sign up for a drug plan, Part D, now, or can I wait? I plan to get a supplement through AARP.
So you sign up for your drug plan. It needs to begin on the date that your Medicare coverage begins. And you don't want to wait later than that. I think you would have a window there, of 2 or 3 months, but you don't want to wait too long because, again, if you wait too long, you have penalties involved with that. And then you're locked out of signing up until the next annual enrollment period. So I would do it. I would sign up for my drug plan as soon as my Medicare becomes effective. Same day.
Same day, okay. Someone has a question about if someone has terminal cancer, do they qualify for health assistance? And I'm wondering if that's like through ACA.
It doesn't automatically cover, but for Medicare, nothing changes other than you are eligible for palliative and end-of-life care coverage the same way that anyone else would.
Anybody have anything else to add? Go ahead.
Depending on your diagnosis, you may be eligible for Medicare even if you're not 65. But this is something you should probably talk to your doctors about, and they may know what you're eligible for.
Okay. Catherine, this person says, if you're a retired state employee, do you have to sign up for Part D on Medicare?
If you're a retired state employee, and before you're 65, that is your primary insurance. When you turn 65, your state employee insurance becomes your supplemental plan. So it depends on what your age is. But again, I would check in with the HR for the retirement plan to make sure that you understand what your eligibility is.
Okay. And Steve, this person has kind of a three-part question. Maybe you can just give a definition of each one. What's the difference between a PPO plan, an HMO, or an HMO POS plan for Medicare Advantage?
HMO and POS is pretty much the same. HMO is it's a type of plan usually where you have a fixed network, so you have to go to certain doctors and certain hospitals. PPO plan is a broad field of networks where you can go anywhere. Uh, but when you go anywhere for coverage, you also have to be aware that a lot of times the copays and the out-of-pocket maximums are more if you're going out of network. Even though it's a PPO plan and you're allowed to go out of network, it can still end up costing you more if you do. So you have to know your plan, talk to your agent. They can advise you. And then with HMO plans, getting back to that, even though they are closed networks, we have many carriers that have really broad nationwide networks. So HMOs are a lot better than they were, say, 10 years ago. They're a lot broader in coverage. So a lot of them are really good plans.
Gotcha. Okay. All right, we're going to take a quick break from this, taking your last questions coming up when we come back.